That's where I wanna be.
Assalamu alaikum, my dear viewers. It is yet another week of an interesting package of Hajj Arena with me, Rashida Yahaya, with a very special edition from Madina. Now, as part of efforts to ensure a smooth 2022 Hajj operations, the National Hajj Commission of Nigeria, NAHCON, has set up a standard and effective medical facilities to oversee the health challenges of pilgrims that may arise. In this special episode, our focus is on the medical outreach in Madina, where we sat with the head of medical mission.
So Hamidu Muhammad Liman, I'm the head of the medical mission here in Madina. Of course, we have a structure under which we have a chairman of the medical mission, and then the commissioner representing Ministry of Health, and then the chief of operations. The chief of operations, of course, because he has to set up the Makkah operation, Dr. Usman Galadima is currently in Makkah to take care of the Makkah operations. In addition to the head of doctors, Dr. Abiola, and then the head of nurses, Hajia Mahmoud Zainab. Every year, the National Hajj Commission of Nigeria takes seriously the health condition and life of pilgrims that come for the Hajj exercise. This year is no different. We have a very robust medical mission. Despite the initial challenges of whether the Hajj exercise will take place or not, the National Hajj Commission has been able to gather over 300 medical experts, medical doctors, nurses, pharmacists, and environmental health officers to take care of the health needs of Nigerian pilgrims. Of course, we do know that whether there is Hajj or not, people have health challenges. And under the stressful condition of the Hajj exercise, some of these health challenges can become aggravated. And that is why medical missions always make sure that we bring indigenous medical personnel to take care of the health needs of these people. Yes, we do know that the Saudi government is trying its best to take care of the pilgrims, but of course, because of the challenges of language barrier, as well as different traditions, it's always imperative to have people who understand the language and the traditions of pilgrims, and that is why the medical mission is here. Every year, the medical mission seeks the permission of the Saudi Arabian government to set up clinics, and we have appropriately done that as in previous years. And the Saudi government, in its magnanimity, has given us the permission to have a main clinic here at Renad Al Masi Hotel, which is outside the Markazia or Haram area. But because it's not easily accessible to pilgrims, we have a special permission to have a smaller outpost within pilgrim accommodation at Al Zahra Hotel and then 3 Point Al Amin. Now, the consolation is that we took cognizance into the location of the hotels of pilgrims before setting up these clinics. So, for example, Al Zahra Hotel is at the south of the Haram, and then whereas the 3 Points Al Amin is in the eastern side. Luckily, we don't have many pilgrims around the western part of Haram this year. And then, of course, the northern part of Haram is the Baqiya, so there are no pilgrims in that region. So with the location of our 2 outposts and the main clinic, so far, alhamdulillah, we don't have problem with linking our patients to the various clinics. And wherever they are, for those who cannot walk to the nearest clinic, we have an ambulance on ground 24 hours that pilgrims can call, a hotline. I will make sure that we mobilize the ambulance to go and pick the pilgrims from the pilgrim accommodation to the nearest clinic, depending on their clinical condition. Of course, we also know that the Saudi government is also trying emergencies that cannot wait for the Nigerian medical mission. The Saudi ambulance also coming to make sure that they evacuate pilgrims to the nearest Saudi hospital. The Ministry of Health in Saudi Arabia is the custodian of the health conditions of all pilgrims from all over the world. But as I said earlier, because of the peculiarities in terms of language, in terms of traditions, they always insist that countries must also support with their own medical mission. And it's based on that understanding that the medical missions try their best to handle minor problems. Anything beyond what the country's medical missions can handle has to be moved to the appropriate Saudi hospital. For this year, the Ministry of Health has designated 4 main hospitals for referrals: King Fahad Hospital, King Salman Hospital, Uhud Hospital, and then Madina Hospital. Okay. Then for those with very serious heart problems, there is the heart center that is near King Fahad. So these are the hospitals designated by the Saudi government that anytime we're empowered to move our patients for treatment beyond what we can handle. Just to make life easy for pilgrims as well as even the Saudi government, we have full license to take care of, as I said, minor problems like upper respiratory tract infection, malaria, hypertension that is not severe, diabetes that is also fairly well controlled, patients with asthma, patients with minor cuts, patients with acute diarrheal illness, and then occasionally you find us also handling patients with minor cuts. So all these ones will be fully empowered to look after them. Similarly, basic psychiatric exacerbation of psychiatric illness, we have also been licensed to bring in appropriate drugs to look after minor psychiatric illnesses. But beyond this, any severe illness that requires admission beyond 24 hours, like severe pneumonia, fractures, appendicitis, conditions that will need surgery, have to be referred to the Saudi hospital. In the three clinics that we have opened, as you are aware, so far a little above 12,000 have come in to Madina, and then some have moved to Mecca. On the average, we receive between 50 to 100 pilgrims every day in these our clinics. And of course, we expect that it's going to increase within the next 1 week due to the rapid influx of pilgrims that will be coming from Nigeria. So as it is currently, the challenges we see patients having malaria, body pains, upper respiratory tract infections, and then the issue of jet lag. Some people are not used to flying. We have seen some cases attributed to jet lag. And then, of course, exacerbation of psychiatric illness. We have already started seeing patients with frank psychiatric illnesses. We've also seen domestic falls. All the hotels have very slippery floors. Incidentally, one of our pilgrims developed a fracture from that. Currently, she's being treated at King Fahd Hospital. I think she will have her surgery later today. Of course, free of charge, courtesy of the Saudi government. So these are the type of illnesses we've been seeing. And luckily, because of the feeding arrangement between the National Hajj Commission of Nigeria unlicensed caterers here in Saudi Arabia, the incidence of food poisoning is virtually zero. Yes, that is one thing we notice and we appreciate about the National Hajj Commission of Nigeria's efforts. Similarly, in the past, when our pilgrims were outside the Haram or Markaziyah area, road traffic accidents used to be very common. Our pilgrims used to be knocked down by vehicles, but now, because they live around the Haram area, it's just a walking distance from their hotels into Haram. So far we have not received any report of anybody being hit by a vehicle. Alhamdulillah, as I told you, over 12,000 have arrived, and to date, we have not lost any Nigerian pilgrim. Prior to 2017, most of the consultations that take place in our clinics were done manually. So manually has its own drawbacks in the sense that we don't have adequate records to justify the funding that has been invested by the National Hajj Commission. And then it's also difficult with the manual system to forecast the type of illnesses that you see so that you prepare for the next Hajj exercise. And then it also checkmates the abuse of drugs, because with the system it's now possible to know how many times a pilgrim has come, when did he come, what were the complaints, so that pilgrims who don't need more than what they need will not have access to multiple drugs, because the computer will check it out. And then it's also made it more easy now to track where the pilgrims are, because we have a system. If a patient is for any reason admitted in any of the Saudi hospital, the record has to be kept in the electronic medical record. So it's very easy wherever you are, even right from Abuja. If you have access to the computer, of course it's highly, because of the security reasons, only people who need to have access will have it. So it's very easy with that to know the pattern of illnesses that affect our pilgrims using the electronic. Yes. Now the campaign ordinarily starts right from Nigeria. The good thing is that the state pilgrim boards have been empowered to have medical boards that are designed to screen pilgrims who have applied for permission to go for Hajj, and then at the same time give them appropriate health education. Now when they come over here, our responsibility is just to emphasize the same message to pilgrims so that they remain healthy, do their Hajj exercise, and go back home safely. So the message is virtually the same, whether it's in Nigeria or here in Saudi Arabia. The consolation is that this year, because of the challenges of COVID, the Saudi government has pegged the age of pilgrimage to 65, meaning that anybody beyond 65 will not perform Hajj this year. So that has reduced many people with multiple medical problems even from home, which pose a lot of challenges here. So for those who are under 65, some may still have some health challenges, for which we continue to advise them to make sure that they adhere to their doctor's instructions, to exercise even before they come, and then to eat healthy diet, drink a lot of water even before they come. And for those that need medications, they are allowed to come with their medications with doctor's prescription and in the original containers. And then, of course, except for the controlled drugs. Controlled drugs are not allowed into Saudi Arabia. So when they come, we continue to emphasize on moderate exercise, but not in this hot weather. And then to avoid unnecessary exposure to the sun. And then to drink a lot of water. And then to use coverings like umbrella and hat that can reduce the exposure to sun. So that's what we do. And then encourage them to continue to eat healthy diet.
MashaAllah, as you've heard from our conversation with the head of medical mission in Madina, Dr. Hamidul Liman, the commission is very much prepared to serve the guests of Allah in every way humanly possible. Thank you for watching. I believe you enjoyed this episode. Remember, I promised you last week that this is going to be a special package from Madina, and I hope you enjoyed every bit of it. For more, please subscribe to our YouTube channel and follow us on our various social media handles. Don't forget, keep a date with us to get all the updates on Hajj and more. See you next week. I remain yours, Rashida Yahya, saying Ma'assalam.
قادر على